The MOUNTAINEER trial was a study conducted to evaluate the activity and tolerability of Tucatinib and Trastuzumab for patients with HER2-positive metastatic colorectal cancer. And we found that the combination was safe, well-tolerated, and clinically active. And based on the high response rate and progression-free survival, this received an approval by the United States Food and Drug Administration earlier this year. The purpose of this study was to explore clinicopathologic features and genomic alterations that may predict for sensitivity or resistance to this regimen, both at the baseline pretreatment time point and then at the time of progression. So in terms of what we found in this study, we first looked at clinicopathologic features and found that patients with left-sided primaries appeared to have a numerically higher response rate than patients with non-left-sided primaries. We found that anti-EGFR therapies did not predict for sensitivity or resistance, so it appeared to have no impact on response rate whether or not a patient had received that in the past. And we also found a slight advantage for treating patients with Tucatinib and Trastuzumab in earlier lines of therapy, but still response rates were high among those patients who were more heavily pretreated as well. When we looked at genomic factors in the baseline pretreatment tissue, there were really no amplifications or mutations that appeared to predict for resistance. And we noticed that response rates remained high even in patients who had ERBB2 mutations at baseline. And then when we looked at circulating tumor DNA, we had some surprising findings. We were expecting that KRAS and NRAS variants would predict resistance to Tucatinib and Trastuzumab, but they didn't in our data. Response rates were about the same, and we think that was mainly because they were subclonal in nature and didn't appear to impact response. In fact, one patient with an NRAS subclone had a response that lasted over 3 years. So we found a number of interesting factors that can be used to guide our practice.